www.healthcmi.com. Acupuncture continuing education online today. Acupuncture and herbs beat drugs for bronchiectasis. So let's take a look. When we talk about chronic lung damage, where the bronchial tubes are permanently damaged, they're unhealthy, they have thickening, they have widening, they can have scarring. And as a result, what happens is the patient has trouble with oxygen levels and chronic infections, to name just a few things, when we're having problems with the bronchial tubes. Monitoring this condition helps to circumvent these secondary issues, especially the recurrent infections. So what researchers did was they compared a powerful antibiotic and a mucolytic agent, which thins the sputum and reduces viscosity so that coughing is more productive. And they compared that with acupuncture plus herbs. Now keep in mind, this is a long-term condition. We're talking about chronic issues. So what they found was that drugs did a very good job, 70% total effective rate with ciprofloxacin and ambroxol, the mucolytic agent. But the acupuncture plus herbs outperformed it with a 96.67% total effective rate. And this is not that unusual in the sense that these powerful drugs are really great in an acute medicine situation to basically save someone's life. But do we really want to be on them long term, especially with all the liver and kidney issues of taking powerful drugs like that over long term? There's a toxicity issue. The body may not be too happy. So there are definite advantages to doing something that is more gentle on the body, like acupuncture and herbal medicine, in these chronic situations. And from my experience and the experience of many people in the field, it's better not to build up antibiotic-resistant bacteria by chronic use of antibiotics anyway. Save it for when you really need it. So, with that said, the acupuncture and herbs just did a better job. And again, it's a chronic situation, so that is usually where something like acupuncture and herbs comes in handy. Yes, they did all the bronchography, the CT scans, the chest radiography. It's a good study. You can go to healthcmi.com, click on news, and look at the article published on June 5th, 2020, Acupuncture and Herbs Beat Drugs for Bronchiectasis. So when you take a look at it, what you're going to see is hospital researchers getting these results. They give you the acupuncture points, how they achieved it, and the herbal medicine. Now, the acupuncture points are no surprise, or you either use the front mu or back shu points of the upper back or upper chest, and then you have herbal medicine. And the herbal medicine is also very interesting, and they give some specifics there. It's a semi-protocolized study because what you find is they have a core set of primary points and then some secondary acupuncture points for specific symptom presentations. Same thing with the herbal medicine. They have a core herbal formula based on, of all things, Bujang Yiqi to tonify the middle and augment the qi decoction. And then they've added some different herbs, for example, if there's an infection, things like that, or phlegm dampness, stuck phlegm or sputum with blood, things like that. They've added some other things. So the exact herbs, the exact points are all outlined in the study, which is great because you can go to healthcmi.com, click on news, and take a look at all of that if you're a licensed acupuncturist as a resource. Now, if people are not familiar with Bujang Yiqi, it's not just a tonic. It's not just a strengthening formula for people with low energy, which we think of that in Chinese medicine. We also use it sometimes when there's such weakness in the body that even internal organs prolapse. It helps to create a lift. This really, what we say, raises the qi. And if anyone's ever had a vitamin B12 shot, that's kind of a temporary lift. But Bujang Yiqi long term can provide an incredible amount of energy. So we use this in patients who suffer from serious exhaustion and fatigue issues as well. We don't want to use it on healthy individuals because raising the qi can be an unhealthy thing for people who normally have a good energy level. But this can quickly restore a heck of a lot of energy. And these are not stimulants. This is not some kind of take a drug, you have energy, like take coffee or some kind of adrenaline type product and suddenly you feel zip, zip, zip. Not at all. These are tonics that actually nourish the internal organs, which then have a better ability to absorb nutrients from food and then help metabolism. So these are nourishing herbs that do the real work long term. In other words, the longer you take it, once you're not taking it, you still have the energy. It's not a quick fix. It's not like having a shot of caffeine or something like that. Bujang Ichi-1 is a serious lift to people with chronic low energy. And again, like for example, you can add for excess, what we call excess phlegm heat, which means inflammation. Heat means that. You would add Huang Qin and Pugong Ying to, for example, get rid of an infection. So, in other words, excess phlegm heat means basically toxic congealed phlegm, and so on. So there are modifications. That's why it's a semi-protocolized study. And the acupuncture simply did a better job. They went deep with this study. They looked at the forced expiratory volume in 1 second, the peak expiratory flow. They also calculated daily activity living scores and things like that. So it was a highly controlled study. I'm not surprised because in the treatment of chronic illness, it's not that unusual to get these kind of results with acupuncture and herbs. It really is the forte of Chinese medicine to long-term help people. And again, someone may have been exposed to industrial vapors. They may have had a chronic illness that injured the lung, for example. And in those situations, when you have thickening and widening of the bronchial tubes, it is a type of permanent damage. And the issue is how to best manage it. And what I'm saying here is the acupuncture and herbs are a responsible and effective method for patients with this condition. So take a look at the article. We hope you like it. This can potentially keep a lot of people out of the hospital. It can help people breathe better, have a better life, get some energy back, help with their oxygen levels, and prevent those recurrent infections so they can reduce or even in many cases eliminate the need for antibiotics on an annual basis. So take a look. Thank you for listening. www.healthcmi.com